Imagine this: you survive a serious accident, you're finally safe. But then a bill arrives that's more dangerous than the accident itself. Not because of what happened, but because of what it costs. Today, I'm going to tell you the truth about medical costs, the part no one warns you about. Medical bills are often far more complex and misleading than they appear at first glance. When a patient receives a bill after treatment, it may look like a straightforward list of charges, but in reality, it reflects a pricing system that is rarely transparent or standardized. Hospitals and healthcare providers frequently assign prices that are significantly higher than the actual cost of delivering the service. These inflated figures are sometimes referred to as charge-master rates, which act as a starting point rather than a final, realistic price. For patients who are unfamiliar with how billing works, these numbers can be shocking and overwhelming, creating the impression that healthcare is universally unaffordable, even when that may not entirely be the case. One of the most surprising truths is that the same medical procedure can vary dramatically in cost depending on where it is performed. A simple diagnostic test or minor surgery might cost a few $100s at one facility and several thousand at another, even within the same city. These differences are not always due to better quality or more advanced technology. Instead, they often stem from internal pricing strategies, administrative costs, and negotiations with insurance companies. This lack of consistency makes it extremely difficult for patients to predict expenses or compare options ahead of time, especially in urgent situations where quick decisions are required. Another factor that contributes to confusion is the disconnect between what healthcare providers charge and what they actually expect to be paid. Insurance companies negotiate discounted rates with hospitals, meaning that insured patients often pay significantly less than the original billed amount. However, uninsured individuals or those receiving out-of-network care may be charged the full inflated price. This creates an uneven system where two patients receiving identical treatment could face vastly different financial outcomes. The process behind these negotiated rates is largely hidden from the public, leaving patients unaware of how much flexibility exists within the system. Negotiation itself is a crucial but often overlooked aspect of medical billing. Many patients assume that the amount listed on their bill is final and non-negotiable, but in many cases, this is not true. Hospitals and clinics may be willing to reduce charges, offer payment plans, or provide discounts for upfront payments or financial hardship. Unfortunately, this information is rarely communicated clearly, and patients may feel intimidated or unsure about questioning their bills. As a result, countless individuals end up paying more than necessary simply because they did not realize that negotiation was an option available to them. The complexity of billing is further increased by the use of detailed codes and itemized charges that are difficult for the average person to understand. Medical bills often include technical terminology and numerical codes representing procedures, medications, and services. Without specialized knowledge, it can be nearly impossible to determine whether these charges are accurate or even necessary. Errors in billing are more common than many people realize, ranging from duplicate charges to incorrect procedures being listed. Yet, because the system is so complicated, these mistakes frequently go unnoticed, leading patients to pay for services they may not have actually received. Ultimately, the structure of medical billing creates an environment where patients are at a disadvantage from the very beginning. They are expected to navigate a system filled with unclear pricing, inconsistent costs, and limited guidance, all while dealing with the stress of health concerns. The lack of upfront clarity means that financial consequences often come as a surprise, long after treatment has already been completed. This disconnect between care and cost not only adds to the emotional burden of illness, but also highlights the need for greater transparency and patient education within the healthcare system. Many people believe that having health insurance guarantees financial protection, but this assumption often leads to unexpected frustration and stress. Insurance is commonly seen as a safety net that shields individuals from high medical costs. Yet the reality is far more complicated. While it does reduce some expenses, it rarely eliminates them entirely. Patients frequently discover that even with coverage, they are responsible for significant out-of-pocket payments. This gap between expectation and reality can be overwhelming, especially for those who have always trusted that insurance would fully support them during times of medical need. One of the main reasons insurance falls short of expectations is the presence of deductibles. A deductible is the amount a patient must pay out of their own pocket before the insurance company begins to contribute. In many cases, these deductibles can be quite high, sometimes reaching thousands of dollars. Until this threshold is met, the patient is effectively paying for their health care, almost as if they were uninsured. This can discourage individuals from seeking early treatment or routine care, as they may choose to delay medical attention in order to avoid immediate financial strain, potentially worsening their condition over time. Even after meeting the deductible, costs do not disappear. Patients are still required to pay co-payments and co-insurance for many services. A co-payment is a fixed fee for specific visits or treatments, while co-insurance is a percentage of the total cost that the patient must cover. These ongoing expenses can accumulate quickly, particularly for individuals managing chronic conditions or requiring frequent medical attention. What may seem like small, manageable payments at first can gradually turn into a significant financial burden, especially when multiple services or follow-up visits are involved. Another hidden challenge lies in the concept of provider networks. Insurance plans typically have a list of approved doctors, hospitals, and specialists known as on-network providers. Receiving care from these providers usually results in lower costs, but stepping outside this network can lead to dramatically higher charges. In some situations, patients may unknowingly receive care from out-of-network providers even within an in-network facility. For example, a patient might visit an approved hospital but be treated by a specialist who is not covered under their plan. This can result in unexpected bills that are only partially covered, or not covered at all, leaving the patient responsible for the majority of the expense. The complexity of insurance policies further adds to the confusion. Terms and conditions are often written in technical language that is difficult for the average person to fully understand. Many individuals are unaware of the specific limitations, exclusions, and requirements outlined in their plans. Services such as certain tests, procedures, or medications may not be covered, or they may require prior authorization before approval is granted. Without this authorization, insurance companies can deny claims, forcing patients to bear the full cost. This lack of clarity makes it challenging for people to make informed decisions about their healthcare and financial responsibilities. Ultimately, the gap between what insurance promises and what it actually delivers can have serious consequences. People may feel a false sense of security, believing they are fully protected, only to face unexpected expenses when they need care the most. This can lead to financial stress, delayed treatments, and difficult choices between health and affordability. Understanding the limitations of insurance is essential, as it allows individuals to prepare for potential costs and approach their healthcare decisions with greater awareness and caution. One of the most overlooked aspects of medical expenses is how quickly hidden fees can accumulate. When patients think about healthcare costs, they usually imagine a single bill covering the main treatment or procedure. However, in reality, medical billing is rarely that simple. Instead of one clear charge, patients are often faced with multiple separate fees that are added together over time. These charges may not be explained in advance, leaving individuals unaware of what they are actually paying for. By the time the final bill arrives, the total can be significantly higher than expected, creating confusion and financial strain. A major contributor to these rising costs is the way services are divided into smaller, billable components. For example, a hospital visit may include separate charges for the doctor's consultation, the use of medical equipment, nursing care, and even the room itself. Each of these elements is billed individually, often without the patient realizing it during their visit. What might feel like a single experience, such as a routine check-up or a short hospital stay, can result in a long, detailed bill with numerous entries. This breakdown makes it difficult for patients to understand the overall cost and to identify which charges are essential and which might be excessive. Laboratory tests and diagnostic services are another area where hidden fees frequently appear. Blood tests, imaging scans, and other diagnostic procedures are often billed separately from the main treatment. In some cases, multiple tests may be conducted, each with its own fee, even if they seem minor on their own. Additionally, these services may be processed by third-party providers rather than the hospital itself, leading to separate bills arriving at different times. This fragmented billing system can catch patients off guard, as they may assume all services are included in one comprehensive charge when they are not. Even basic medical supplies can contribute to unexpectedly high costs. Items such as bandages, gloves, syringes, and medications administered during treatment are often billed individually. While each item may seem inexpensive, their combined cost can become surprisingly high. Patients are rarely informed about these charges beforehand, and they may not realize that they are paying for every single item used during their care. This lack of transparency can make it feel as though the system is designed to add costs in ways that are not immediately visible, further increasing the overall financial burden. Emergency situations can make hidden fees even more impactful. When a patient requires urgent care, there is little time to ask questions or consider the financial implications of each service. In these moments, the focus is entirely on receiving immediate treatment. which is both necessary and understandable. However, once the situation has passed, the resulting bills may include a wide range of charges that were never discussed. Emergency room fees, specialist consultations, and additional procedures can all be added without prior explanation, leaving patients to deal with the financial consequences after the fact. The cumulative effect of these hidden fees is what makes them particularly challenging. Individually, each charge might seem manageable or even reasonable, but together they can create a total that is difficult to afford. Because these costs are spread across different services and sometimes billed at different times, patients may not fully grasp the extent of their expenses until it is too late. This gradual buildup of charges highlights the importance of greater transparency in medical billing, as well as the need for patients to carefully review their bills and ask questions whenever something is unclear. Medical debt has quietly become one of the most widespread and damaging financial challenges people face, yet it often remains hidden behind closed doors. Unlike other types of debt, such as loans or credit card balances, medical debt is rarely planned or anticipated. It usually arises from unexpected health issues, an accident, a sudden illness, or a necessary procedure that cannot be delayed. Because of this, individuals are often unprepared for the financial impact, both emotionally and practically. What begins as a health concern can quickly evolve into a long-term financial burden, affecting not just individuals but entire families. One of the most troubling aspects of medical debt is how quickly it can escalate. A single hospital visit or treatment can result in bills that far exceed a person's savings or monthly income. When patients are unable to pay these amounts up front, the debt is often carried forward, sometimes with added interest or penalties. Over time, this can grow into a significant financial obligation that becomes increasingly difficult to manage. Unlike other expenses that can be adjusted or avoided, medical costs are often unavoidable, leaving individuals with little control over the situation once treatment has been received. The impact of medical debt goes beyond finances and begins to affect a person's overall quality of life. Constant worry about unpaid bills can lead to stress, anxiety, and even depression. Individuals may find themselves losing sleep, struggling to focus on work or studies, or feeling overwhelmed by the pressure of their financial situation. This emotional strain can be especially difficult because it often follows an already challenging health experience. Instead of focusing on recovery and well-being, patients may be forced to shift their attention toward managing debt and dealing with financial uncertainty. Medical debt can also have long-term consequences on a person's financial stability. Unpaid bills may be sent to collection agencies, which can negatively impact credit scores. A lower credit score can make it harder to secure loans, rent housing, or even find employment in some cases. This creates a cycle where one medical event can lead to ongoing financial difficulties that extend far into the future. For many individuals, the effects of medical debt are not temporary but lasting, influencing major life decisions and limiting opportunities. Another serious consequence is that medical debt can discourage people from seeking necessary care in the first place. When individuals know that treatment may result in overwhelming costs, they may delay or avoid visiting a doctor, even when they are experiencing serious symptoms. This can lead to worsening health conditions that eventually require more intensive and expensive treatment. In this way, the fear of debt not only affects financial well-being but also puts physical health at risk, creating a dangerous cycle where problems grow larger over time. The silent nature of medical debt makes it particularly difficult to address. Many people feel embarrassed or reluctant to talk about their financial struggles, especially when they are related to healthcare. This lack of open discussion can create the impression that the problem is less common than it actually is, preventing broader awareness and solutions. In reality, countless individuals are facing similar challenges, navigating a system that can be both complex and unforgiving. Recognizing medical debt as a widespread issue is an important step toward understanding its impact and the need for greater support and transparency within the healthcare system. A major issue that contributes to the stress and confusion surrounding healthcare expenses is the lack of transparency in pricing. Unlike most other services where costs are clearly displayed before a purchase is made, medical treatment often comes without a clear price tag. Patients usually enter a hospital or clinic without knowing how much they will be charged for consultations, procedures, or tests. This uncertainty can make it extremely difficult to plan financially, especially for those who are already dealing with the anxiety of a health concern. Without upfront information, patients are left in a position where they must agree to care without fully understanding its financial implications. This lack of clarity is further complicated by the way pricing information is structured within the healthcare system. Even when costs are technically available, they are often presented in formats that are difficult to interpret. Lists of procedures, codes, and varying rates can be overwhelming for someone without a background in medical billing. Patients may try to research costs in advance, only to find inconsistent or incomplete information that does not reflect what they will actually be charged. As a result, making informed comparisons between providers becomes nearly impossible, leaving individuals to rely on guesswork rather than clear, reliable data. Another challenge is that the final cost of treatment is often influenced by multiple factors that are not immediately visible. These can include the patient's insurance plan, the specific provider, the type of facility, and even the duration of care. Two patients receiving similar treatments may end up with very different bills due to these variables. Because these factors are not always explained beforehand, patients may assume they have a general idea of the cost, only to be surprised later when the final amount differs significantly from their expectations. This unpredictability adds another layer of difficulty to an already complex system. Communication between healthcare providers and patients also plays a role in the lack of transparency. In many cases, discussions about cost are either brief or entirely absent. Medical professionals are primarily focused on diagnosing and treating health conditions, which is understandable, but financial aspects are often treated as secondary concerns. Patients, on the other hand, may feel uncomfortable bringing up questions about money, especially in situations where their health is at risk. This gap in communication means that important financial details are often left unaddressed, leading to misunderstandings and unexpected expenses later on. The billing process itself can further obscure the true cost of care. Instead of receiving one clear and comprehensive bill, patients may receive multiple statements from different providers involved in their treatment. For example, a single hospital visit might result in separate bills for the facility, the physician, the laboratory, and any specialists who were involved. These bills may arrive at different times and include charges that are not clearly connected to one another. This fragmented approach makes it difficult for patients to see the full picture of their expenses, increasing confusion and reducing their ability to verify the accuracy of the charges. Ultimately, the lack of transparency in medical pricing places patients at a significant disadvantage. Without clear, accessible, and consistent information, individuals are unable to make informed decisions about their health care. They are left to navigate a system that is not designed with their understanding in mind, often discovering the true cost only after services have been provided. This disconnect between care and cost not only creates financial stress, but also undermines trust in the healthcare system, highlighting the importance of clearer communication and more straightforward pricing practices. Awareness is one of the most powerful tools patients can have when navigating the complex world of medical costs. Many of the financial challenges associated with healthcare arise not only from high prices, but from a lack of understanding about how the system works. When individuals are unaware of their rights, options, and responsibilities, they are more likely to accept charges without question and pay more than necessary. Gaining even a basic level of knowledge about medical billing, insurance terms, and common practices can make a significant difference. It allows patients to approach healthcare decisions with confidence rather than uncertainty, ultimately helping them avoid unnecessary expenses. One of the simplest yet most effective ways to reduce medical costs is by asking questions. Patients often hesitate to speak up, especially in clinical settings where they may feel intimidated or overwhelmed. However, asking about the cost of a procedure, whether a test is necessary, or if there are more affordable alternatives can provide valuable insight. Healthcare providers may not always volunteer this information unless prompted, so taking the initiative to inquire can lead to better financial outcomes. Even small questions can uncover options that save money without compromising the quality of care, making communication an essential part of cost management. Requesting an itemized bill is another important step that can help patients gain control over their expenses. Instead of receiving a single total amount, an itemized bill breaks down each charge into individual components. This detailed view allows patients to see exactly what they are being billed for and to identify any potential errors or unnecessary charges. Mistakes in medical billing are not uncommon, and without reviewing the details, patients may end up paying for services they did not receive or for duplicate entries. Taking the time to carefully examine each line of a bill can lead to corrections that significantly reduce the overall cost. Comparing healthcare providers is also a valuable strategy that many people overlook. Just as individuals compare prices when shopping for other goods or services, they can do the same with medical care when the situation allows. Different hospitals, clinics, and laboratories may charge varying amounts for the same procedures, and these differences can be substantial. By researching options in advance, patients can choose providers that offer quality care at more reasonable prices. While this may not always be possible in emergencies, it can be highly effective for planned treatments, routine checkups, and diagnostic tests. Understanding the details of an insurance policy is equally important in managing medical costs. Insurance plans often include specific rules about coverage, networks, and approval processes that can greatly affect how much a patient pays. Knowing which providers are in network, what services require prior authorization, and how deductibles and co-payments work can prevent unexpected expenses. Without this knowledge, patients may unintentionally make choices that lead to higher costs, such as visiting out of network providers or undergoing procedures that are not fully covered. Taking the time to review and understand these details can help individuals make more informed decisions about their care. Ultimately, becoming an informed and proactive patient transforms the entire healthcare experience. Instead of feeling powerless in the face of complex bills and unclear pricing, individuals who are aware of their options can take steps to protect themselves financially. This shift in approach not only reduces costs, but also brings a sense of control and confidence. By asking questions, reviewing bills, comparing providers, and understanding insurance, patients can navigate the system more effectively and minimize the stress associated with medical expenses. Now that you know the truth about medical costs, the hidden charges, the limits of insurance, the silent burden of debt, and the lack of transparency, there's one thing that becomes clear: this is not just a system problem, it's an awareness problem. Because the moment you start asking questions, the moment you stop accepting every bill at face value, the moment you take control of your choices, everything begins to change. Healthcare should heal you, not financially harm you. So don't just be a patient, be informed, be aware, and most importantly, be prepared.